I am a single mom. I have two young boys. My oldest, who is 15, is a special needs child. He threatened to commit suicide in March of 2021. We were recommended to go to the emergency room. So I took him to our local hospital, where he was not admitted. He was in a bed for the day in the emergency room. It began with a triage of some very nice professional nurses. And then we had some professionals come in throughout the day. They were very kind, very compassionate. My son was severely depressed. He does not communicate with most people, especially individuals that he doesn't know. The individuals that we worked with were especially caring and tried to reach out to him and show him compassion, which really helped him to open up and to talk a little bit about what he was feeling. And he had a very strong desire to not go anywhere, associate with anyone. He did not want to even communicate with friends. He was isolating. And so it was very difficult. He did not want to communicate with myself and his father. And so we had a very difficult time trying to understand what was happening since he wasn't communicating with us. The individuals that came into the emergency room, and there was nurses, there was doctors, there was emergency personnel. He was in a safe room, and they were very professional, but yet very kind and compassionate, and really tried to bond with him so that he opened up to them. That was just the most important aspect. They remained calm. Of course, there was no accusations. They simply tried to connect with him and get him to communicate his needs to them. So we were there for a 12-hour period. It was a nurse came in and brought an actual telemedicine video in, and a psychiatrist was live and did an evaluation. I will say that I was really disappointed with the psychiatrist. He led my son in questioning, and it appeared as though my son was not having struggles. By the end, it took about 10 hours to get someone on video. So he had, at the end of the day, appeared as if those issues were resolved, which made for a difficult diagnosis and follow-up care. So the most important thing would be to ask open-ended questions and to bond, to try to get him to communicate, especially with my son. He just does not trust any outside individuals that we have not had any communication with. My son is non-violent, non-aggressive, just very isolating and does not like to communicate. And so it's been a very difficult struggle because of that initial evaluation with emergency and hospital personnel. It's made it extraordinarily difficult for us to find the assistance that we need because of that initial evaluation. So it just being aware of a child's ability or non-ability to communicate well, and taking into an account the parent's perspective many parents do have, and some parents don't react well in those situations. I have an emergency response background myself, so I have some knowledge and ability, but many parents don't have that or the knowledge, and so their response may look different, but just knowing that, communicating with the parents as well to confirm the best way to communicate, but being compassionate and caring is one of the easiest ways to gain an understanding of what's going on. So my son, like I said, he really does not like to communicate with others that he does not know. So specifically asking him questions, beginning with simple questions about your name, your interests. Many professionals that we have worked with have started out with asking just basic questions about his interests, what he does, what a day looks like, instead of speaking with him on a level that he may not understand with medical terminology and asking him questions about depression or how he feels. He's not going to feel comfortable answering those questions if there isn't some kind of a connection with the person who's asking them. So just establishing a connection with him initially. And my son especially does not react well to individuals that may have a louder voice. He has a noise sensitivity. So speaking more quietly and calmly, and just trying to build that connection with basic questions about him instead of going right into some of the medical questions. So if a responder were to come into a room or into our house, he immediately is fearful. He doesn't know and he doesn't understand who they are, why they're there. It's difficult to communicate that to him. So if we can build a rapport and have a discussion, just starting out on a basic level of communicating with him about who he is, then he will open up and then start discussing more about himself. He may mention that so loud noises it makes it difficult for him to, that especially makes it difficult for him to think. So if there's a lot of activity, for example, if someone would come into our house, an emergency responder would come into our house with a lot of equipment that makes noise, that could make it difficult for Torrin to focus on what's being said. He's going to be distracted by that. So walking into a home or a situation with less things that are going to be there that are going to make noise and distract. He also does have a touch sensitivity. I have not had emergency personnel come into my home because he has a touch sensitivity. So if he were to be grabbed, then he might react. Because that is something, he does not like to be touched. He does not like to be hugged. He doesn't like to be grabbed in any way. So that escalating it to that point, in a situation where he would be a harm to himself or others, that would be a situation that would need to be contained. But if he is not a harm to himself or others, just coming in and having a discussion first would be the best way with all the sensory issues going on. That would be the best way to connect with him. So I would if a first responder was coming in, I would first very calmly just have a conversation with him. And like I said, first build a rapport, if that is possible. If with my son, because he is non-aggressive, likely you would be able to come into the home and talk with him first. If it was a situation where he was out of control, I would like to have a first responder come to me first, and and I would be able to tell the first responder where it would be okay to touch, how it would be okay to touch, if that is a possibility. So if a first responder is coming in and there is a situation, if at all possible, to talk with him and say, okay, this is what's going to happen, or communicate it to me so that I'm able to communicate it to him. This is what's going to happen. That would be the best approach.